Hi, I'm Dr. Tani Ping, consultant obstetrician and gynecologist. So now let's talk about prevention. That's what I'm here to talk. Two things you can do. Two things of prevention we want to cover. First, let's talk about primary prevention. Primary prevention means the cancer don't come at all. One you can do is don't have sex lor. Don't have sex for the rest of your life. No cervical cancer. So simple. So good news for all the singles. If you're single then and you never have sex before and you never have sex in the future, then you will never have cervical cancer because you will never have HPV infection. But there are also other ways of prevention. There is immunization. We already have HPV virus immunization, which is already now available in school. All Form 1 girls will be getting the injection. It is under our government program. Everybody gets it for free. For those of you who are no longer in school age, you can still take the vaccine. The age limit for vaccination is 45. 45, you know? Okay, there's a lot of stories that I hear. People say that once you're married, it's not effective, or you've reached a certain age, it's not effective. Or yes and no, the effectiveness reduces with age. Yes, it reduces with age. But still, by 45 years old, it is still worth taking because it is the second commonest cancer in Malaysia women. So even if it protects you by 50%, better than nothing. So primary prevention is two. One is avoidance of all sexual intercourse. Number two is vaccination. And one thing, avoid sex here, not condom. Some people just use condom only. Condom doesn't protect you from HPV virus at all. Then secondary prevention. How do we prevent getting cancer when the cancer is already coming? And that is what we call pap smear test. This test has been there for so many decades already. And for certain countries where the pap smear coverage is good, near 100%, all these countries actually, mainly the developed countries, and actually they have shown like almost negligible number of cervical cancer. So if everybody do pap smear regularly, then you won't have cervical cancer anymore. So when do you start doing pap smear? 1 year after sexual intercourse. That is the key. We don't care how old. We also don't care whether you're married or not. Pap smear must be done 1 year after you start having sexual intercourse. Okay? And for the first 3 years, you're supposed to do it every year. First 3 years, you do it every year. And then after that, if your first 3 years is totally normal, you can actually do it 3 years once after that. But that is again based on one presumption. Based on what presumption is that? That you do not get any new virus infection in the future. Or there's another thing you can do. You can also do HPV tests. If you do a pap smear plus a HPV test, then yes, maybe you don't need to do every year. Maybe you can do 3 years once. Because HPV comes first, then abnormal pap smear, then cancer. Okay? So this is how the progression works. But also you need to depend on your lifestyle. Because I did mention about lifestyle, your immune. Because in this group of women, I noticed that actually they get cancer a lot faster. We have people that do pap smear every year. Today they are abnormal. Next year they are pre-cancer. Another year they are cancer. But you go back and look at their life, usually highly stressed. So need to look at your life. If you are not stressed, sleeping well, enjoying life, having a good life, don't smoke, healthy lifestyle, every day go yoga, swimming, husband also healthy, don't smoke, then of course you not necessarily have to do it so frequent. You can do, if you do a HPV test plus a pap smear, you can do it every 3 years once. Okay, there's many brands out there, but the latest version, which is Gardasil 9, because it covers 9 viruses. So you have vaccines that cover 2 virus, 4 virus, or 9 virus. Even the 2 virus is still not too bad. Why? It's okay lah, 2, because it covers the 2 strongest virus already. These 2 virus is very strong one. you get it very fast, cause cancer. The rest don't form cancer so long, it can last longer. So if you are going to get the newest one, which is 9 viruses, which is Gardasil 9, it is ranging between 1,004, 1,005 like that for 3 doses. Okay, it's 3 doses. Yes, the answer is yes, because this vaccine, they have done all their research on women, and you know lah, women, even though they say I'm not planning, there will still be some women in the research group that accidentally got pregnant one. And we know those women who got pregnant, even though they're in the research group those days when we were doing the research for HPV virus, they actually all had normal pregnancy and normal baby. So it's okay. But if you're pregnant, we wouldn't start the vaccine. Okay? If you're pregnant, we won't start the vaccine. But if you have started the vaccine, let's say 1 dose, 2 dose, and then you got pregnant, it's fine. The last dose, we just give it after you give birth. No big deal. Okay? So, okay. So, that's all for tonight's. Okay? Thank you and bye-bye.